Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great topic to cover, which is the sequencing of your lateral flexion or side tilting and rotational exercises for degenerative disc disease. Hope you enjoy. So having the right sequence in your exercises is imperative for the healing stimulus to your lower back degenerative disc disorder. There are many trainers, therapists, and doctors that are prescribing exercises and people learning exercises without ever considering what the sequence of your exercises left to right is, which many times is only going to aggravate your condition. If you have taken an analysis of your body mechanics, which of course is essential to any healing exercise, and have realized that you have a tendency to lean more to one side or a stronger leaning to one side, or elevating a hip on one side, such as comes from a habit of turning your leg out more on that side, or if you have a tendency to rotate more easily to one side with either the torso or the pelvis, and we all have these asymmetries because no one is perfectly symmetrical. If you've identified your problem, you're going to use that in the sequence of your particular exercise, whatever you're doing. If you're doing, let's say, a rotational exercise to work the muscles that stabilize twisting, such as your abdominal obliques and latissimus and erector spinae, and let's say you're doing a diagonal chop exercise, or you're doing a TL rotation exercise where you're holding a band, holding your core, and twisting the hip and pelvis as one unit, or even doing any kind of abdominal twisting sit-up or crunch exercise, you need to realize you want to make sure that you're leaving the body in a corrected position. For instance, if I have a tendency to twist to the right with my rib cage, and when I look in the mirror or I do a self-exam and find that my body twists easier to one side, that side that I easily twist to is going to be the side I'm going to exercise to first. I'm already used to being strong in that direction. But I want to end my exercise twisting into the direction that's tighter for me, because if I end that way, it's going to end the body in a corrective motion. It's going to neurologically and both muscularly and fascially allow my body to end in a slight stretch or corrective motion. If I don't take this sequence into consideration, many times I will end in my strong side, which is only going to promote more tissue stress on my discs, on my facet joints, on my various spinal ligaments, tendons, and muscles. So, for instance, if I'm doing a rotational full spine extension exercise, where I know that my pelvis likes to twist to the right, I want to make sure that I'm twisting to the left or rotational direction of my torso to the right. Remember, the torso and the pelvis move in opposite directions many times. So I want to take that into consideration. I would want to go to the other side first and do my reps there, and end with my reps going into the direction of correction. If I'm doing a chop exercise and my torso has a tendency to lean left, that's the side I'm going to chop to first, and I'm going to end chopping to the right, so I'm leaving my body in that correction. It heightens the nervous system, it helps to stretch fascial tissues, it helps to stretch muscles. The disc fibers themselves, remember the fibers in your disc crisscross every alternate layer. You want to make sure you're torquing that disc slightly in the corrective direction. This applies also to side tilting or lateral flexion exercises. If you have a tendency to lean more to one side, compressing the disc on that side, or having a hip elevate on that side, that's a lateral instability. You're creating more compression on the disc on one side, more tensile or overstretching disc force on the other side. You need to take that into consideration with your exercises. If you're not, you're usually promoting more dysfunction in your spine and actually aggravating your condition with your exercise. So, let's say you do a farmer's walk. You have a heavy dumbbell that you walk one side. What this is doing is the natural tendency is to lean into the weight, so you're creating tension on the opposite side muscles of your rib cage and your back and your abdominal muscles to hold you up in a correct position. If I have a natural tendency to tilt to that side, then that's the side I want to end with. I want to hold the bell on that side, so I'm strengthening the muscles that pull me away. Same concept as rotation. We want to end in a direction of correction. Again, if I have a tendency to hip hike on that side or lean to that side, I'd want to take that in consideration with exercises such as cliffhangers, where I'm oscillating the legs, increasing the stability of the muscles on lateral flexion or side stability. I'd want to make sure I'm using that side up last because it's strengthening the weakness. The left side, which is usually open, because I'm compressing the other side. I want to do that side first with the exercise, that side last. Side plank, same thing. If I have a tendency, again, we'll stay with this concept, if the right side is compressing, I want to make sure I keep that side open at the end, right? So that means with any kind of side plank, I'd want to end with that side, the problematic side, up, because in side plank motions, whether you're doing it off your arm or off your shoulder, as you lift the hips, so you're staying in that side plank position, you're using the muscles along the bottom of your body, the abdominals, the back muscles on that side to contract, and it opens up the involved side. If you don't know where your particular issues are, mechanically, posturally, I invite you to go to either the Posture Size website or the Pain Free and Fit website. We have a free body analysis there. Learn where your unique problems are. We all have them. Almost every patient client I've had over the last 28 plus years in doing this has some type of issue where they are stronger, they have a tendency to lean or rotate to one side, and it's a huge portion of why their pains are either resolving or not resolving if these things are not being addressed. If you like this video, I invite you to subscribe to our channel. We got a lot more videos on degenerative discs, training core muscles, and healing exercises for degenerative disc problems. If you'd like to help me share this vital information with others, give me a thumbs up below. Any questions or comments, I'll do my best to get back to you. I hope starting to think about sequencing in your exercise program, in your workouts, will help you prevent pain with your degenerative disc condition.